buenas tardes tengan todos ustedes de nueva cuenta en este maravilloso espacio de Design México. En esta ocasión tenemos una sesión con panel de discusión. Esta sesión se va a llevar a cabo por el grupo internacional de la Walter Dandy Neurosurgical Society con estudiantes de diferentes partes del mundo. Primeramente queremos agradecer a todo el comité organizador encabezado por el doctor Jorge Herrera, quien es chairman de este importante congreso internacional, y por supuesto al doctor Salim Abdurrov, quien es copresidente de este importante congreso. Asimismo, hacemos mención de la colaboración activa que tenemos también con diferentes presidentes y mesas directivas de otras asociaciones, tales como la ANSI-PN. Doctora Natalia Fedorchenko, le cedo la palabra.
Yeah, thank you, Alejandro. Hello, everyone, and welcome back to join. Thank you for joining us, and welcome back to the World Congress of Neurosurgery. Today we have one of the closing days of the Congress, and it's time for the young generations of people who is going to be the great future of neurosurgery, and not only to have their word and to share their experience, impressions, and knowledges to all of you. So today it will be the round discussion of Walter Dandy Society presidents and members from the 5 countries like Georgia, Turkey, UK, Germany, and Egypt. So each of them will present themselves when they start to talk. And for now, I would like to say thank you for the organizing committee of the World Congress of Neurosurgery in honor of Professor Gazia Sargil, to Mr. Jorge Herrera, Ambassador of UNESCO, and also Chairman of the World Congress of Neurosurgery, to Professor Salim Abdulraouf, Global President of Walter Dandy Society and in Chief Abdulraouf Institute of Neurosurgery, and founding chairman in Department of Neurological Surgery in the St. Louis University. So we are grateful to him also for the support and for being moderator with us all this time. Also to Dr. Daniella Casillas from Mexico, the president of AANS Neurosurgical Society, and also vice chairman of the World Congress. And to Dr. Babak Kateb, president of the Society for Brain Mapping and Therapeutics, and Brain Mapping Foundation, and vice chairman of the World Congress. Also, the honorary chairman of the World Congress is Professor Nasser El Gandour and Professor Marcus Rota. So we are really grateful to all these people for their speeches, for their support, and for their all of what they can share to us. So now, please, our group of people from Walter Dandy Society, you have your time to have your word and to introduce yourself, to share your knowledges, and they are going to talk to us about the past, present, and future of neurosurgical education and another stuff they would like to present. So you're welcome, guys.
Thank you. Thank you, everyone. This is my first time going live, so let's hope it's good. First of all, good morning, good afternoon, and good evening, since we come from very different time zones. I would like to thank everybody who's done such selfless job in putting us all here. I would like to thank my team members. We come from so many different places, but we're heading toward a very similar goal. It's an honor to be here with you. I'm Yusra Arafe. I'm the president of the Jordan Walter E. Dandy Club. I'm happy to be here today. I'm an author. I'm a published author and a very bold feminist. So it's really good to be here. So let's talk about this. When we talk about neurosurgery, the first thing people think about is how advanced it is, how difficult it is. You're basically inside somebody's skull. It's kind of very traumatic. And surgery itself is trauma. Let's remember that. So to know to actually know how advanced it is, we have to take one step back, or basically like 10 steps back. Because now we have all the imaging, now we could actually visualize where tumors were. But in the 18th or 19th century, that was not the case. Thank you, Jason. That was not the case. So let's go back to where it actually started. When I was doing the reading, because I was very interested to know when was neurosurgery conceived, because it's a very complex specialty, studying wise, residency wise, and everything. So it actually started prehistorically, over 10,000 years ago, and they found skulls that had pearl holes inside of them, all over like 6 continents, from Portugal to America to Egypt to everywhere. And they were done, the only instruments there then were stones, were very sharp stones. So those were the first neurosurgical instruments. For anesthesia, they used plants. For clotting the wounds, they used meat. They used honey. They would suture with thorns. I mean, we've come a very, very long way from that. So prehistorically, there were portholes. And then we moved to Egypt, the very beautiful Egypt, that they were actually very, very advanced. While I was reading, I was very impressed with how advanced the pharaohs were. I mean, they would use plants as anesthetics to prolong the procedure. And honestly, they had high survival rate and low infection rate, because without actual anesthesia, the patient, if I would put a drill in your head, I bet you would not take it for a minute. So the procedures were very, very short. So funny, that actually contributed to very low infection rate. And all we have from there are basically case series, very ancient looking case series of conditions like spinal dislocations and hemisections and observations that led to the moment that we are here today. So we have crossed a very long way, because last week I had the great honor of watching Professor Salim Abdulraouf dissect a perforator of an aneurysm, which has so many technologies involved into it. So what I'm trying to say here is neurosurgery in practice has existed for a very long time. Very, very long time, tens of years ago. And right now, the education, I mean, I have read that one surgeon started being a surgeon at the age of 17, because there were no educational, there were no schools back then. It started at Johns Hopkins with Harvey Cushing, the father of neurosurgery, in Baltimore. And we started from boreholes, and now we're dissecting perforators of an aneurysms. And you only realize how amazing this is when you go back and see the tools, the actual tools, the stones that were used. So when we get to this point where we have schools, we have residency programs, we have clocked hours, we have operation room hours, and all that, we do come from very different places, and those programs tend to differ a bit in structure. But the advancements we have here today, and what we're going to be discussing, the research opportunities now, and how advanced the literature truly is in regards to neurosurgery, is very fascinating. So we're here now, and my colleagues and I would be discussing further with you the different aspects of neurosurgery. Without further ado, Ibrahim, would you please tell us?
Hello. Thank you so much, Yusra. And thank you so much, Natalia, and all the organizers. It's such a great pleasure to be able to speak on this forum. I'm really honored. Unfortunately, I will have to disrupt this beautiful slideshow because I will not present slides today. I would really just want to share with you what I was reflecting upon on my train ride back from the hospital just earlier today. So I'm basically traveling to the hospital 1.5 hours, so I had plenty of time on my way back. I think very a general thing. I mean, I'm a very big fan of education, and I was privileged to be able to contribute to a project which aims to democratize education, not really a neurosurgical education, but on a more fundamental way. Primary school, middle school, and high school education, to make it available to a broad audience, to make it available to families and places which perhaps lack the infrastructure or the resources to gain that knowledge. Now, I'm very glad and proud to see that we, not only in Dandy Germany, but also in the entire Global Dandy Clubs initiative, we have really embodied the term democratization. So we really try to democratize access to neurosurgery education, for example, but also access to neurosurgery research. That is why we're a global team, and we have representatives from different countries here today. And I think right now we have really enthusiastic students from all across the world coming together and working together on either research or educational opportunities. And in Dandy Germany, we really wanted to address neurosurgery, neurology, but also like any other neuroscience related specialty from 3 different standpoints. So obviously one being education, right? But then also we always wanted to be scientific, and we also wanted to be social. Social meaning we always wanted to address topics that were of a socioeconomic, or political nature, right? Or something that is society related. So that is why in Dandy Germany we made women in neurosurgery, gender equity, but also diversity in neurosurgery one of our main aims of research, and also like social projects that we want to help propel. And I want to focus on education now. And one thing that we have done straight away, once basically entering the pandemic, we thought we somehow have to make the best use of the limited resources that we have during a lockdown. Right. We're always dreaming of skills labs or different like hands-on experiences and courses, etc. But we were really limited to our internet connection and to Zoom licenses. And that is how, Jason and I, we had our nighttime calls, and decided to just give it a try and invite some senior professors to give a talk to us. And it has really grown, and this is something that all global Dandy clubs do right now. That is why we also have joint events and also multinational conferences now, where we really are able to gather like 200 or 300 students in the audience. So that is really just to invite all of you to join in, because we're really there to help you, to support you, and to make neurosurgery education accessible to the entire world. Having advertised our own efforts now, let me move on to something that is very important to me. And this was really what I was thinking about when I was on the way back from the hospital today. And it is something that has become and established itself as one of my main interests, and that is not just education of medical students, or like neurosurgery residents, whatever, but also neurosurgical patient education. And this is something, I mean, obviously it is very important, and we're being told this at med school as well. We do have our training sessions where we try to learn how to communicate with patients and stuff. But still, I feel it is extremely underrepresented in the curriculum. And we're seeing trends and potential problems that come along with the lack of time that is devoted to patient education in this specialty. Obviously, I mean, in neurosurgery, we might have very little time to devote to each patient individually. But I mean, some trends are really of concern. And that is, for example, I mean, I've rotated through neurosurgical departments on different continents, but I could always see some similarities. Like everywhere, there would be patients who would actually cancel their appointment. They would not show up to the surgery because, I don't know, perhaps they were scared, or they just did not feel comfortable enough about their decision to undergo surgery. The other thing is, obviously, we're in a digital world now, and access to medical information is becoming increasingly easier. And that is why patients obviously are more well informed about the procedures that they would undergo than they were back 10 years ago. A problem is, they are for sure more well informed, but perhaps in some occasions, they might believe they're more well-informed than they actually are. And the problem for that, of course, is also the lack of quality of knowledge that is being provided in the internet, right? And one thing that we try to do now is to assess the quality of medical information that is provided via platforms like YouTube. Right. I mean, you can type in anything you want. You can type in hydrocephalus and VP shunt and spina bifida and whatever. You will find thousands of results, and you will find results from the most prestigious and elite institutions around the world. But one thing that is really striking is, I mean, these videos are not meant to be biased in the first place, right? I mean, these are not pieces of scientific information. They don't have to be biased. So what happens is a lot of them are rather of a commercial nature, and a lot of them are just not really of educational value. And that becomes extremely problematic when patients arrive in the hospital and their expectations might be completely different from what neurosurgery can actually provide. And I think so. This is another problem that we're facing. And obviously, no matter how annoying some questions might be, or how stubborn some patients might be, obviously it is part of our responsibility and part of the reason why we've chosen medicine, to deal with this and to be able to provide the best help possible to our patients. And that is why we have to somehow find a way to solve this. And I think we as a young generation will be dealing even more with these trends and with these potential problems in the future. So we should be aware of this. And I think a substantial portion of the audience today is also composed of students. Why I think it is important for us to have a look at this together. I mean, when we talk about patient-centered care and shared decision-making, informed consent, right? I mean, we have arrived at this stage of medicine now, where this becomes more and more important. So the doctor is becoming less important when it comes to making executive decisions on the health of the patient. So it is rather the patient, him or herself, who should be really making the final decision, or who should be given material and information to reflect on his or her treatment. Now, I think it is going to be, especially us, like the young people, interns, residents, who will have a lot of these conversations in the future, right? It is usually the young doctors who have to obtain informed consent after providing educational information to the patient. So that is why I feel this is important to talk about. Now, one reason why patients might not show up to the surgery is obviously preoperative anxiety, right? So they might not feel confident enough, well prepared enough to actually undergo that surgery. Now, I feel like when I think back to all of the conversations that I was able to witness, I mean, honestly, like, rarely have I seen that enough time was devoted to really asking whether the patient was anxious, what his or her concerns were, like what is it that goes through the patient's mind on the day before the surgery, right? What is it exactly? I mean, obviously we can all anticipate what's going on in the mind of that patient, because it might be the fear of losing control, the fear of becoming disabled, the fear of not being the same person after surgery. Obviously, I mean, we all know this, we can all anticipate this, but what really makes the change is to ask the patient and have the patient open up about this, right? This is how I think patient satisfaction, the doctor-patient relationship is really fostered. And I mean, this is something, like, I can't give you numbers, but I have read through a lot of RCTs even. I mean, randomized controlled trials even exist on this topic in the neurosurgical literature. And there is no doubt that patient education has a better impact on preoperative anxiety than prescribing benzodiazepines or antidepressants and stuff, right? Even on postoperative pain, doctor-patient communication can have a better impact than postoperative sedation or analgesia, right? So a third trend is for sure the rise of medical legal issues that neurosurgeons have to face. And this is something that, I mean, all of us have heard about the United States, right, where medical legal issues are, encountered more frequently. But I do feel that a lot of countries around the world are catching up on this, unfortunately. And also, studies have shown that patient education, doctor-patient relationship can really reduce or restrain the rise of medical legal issues that are faced. So that is why I really want to stress this, because I mean, I only started like a couple weeks ago to think about this and to think about ways how to conduct research on this field and how to help support this. Because it is simply something that we might not think about. I mean, like Sieda and a lot of other speakers today have already elaborated beautifully on neurosurgery education. That is why I wanted to lay that aside and rather focus on something that has not been touched upon so far. And I think that is something very important. Now, if I have like 3 additional minutes, I just want to give you one example, and just to make it a bit more, visible. A couple months ago, I was sitting in class, and at the Charité University in Berlin, we have this cool course format where we're supposed to learn doctor-patient communication, but also like interdisciplinary communication and teamwork, etc. And one of the things that we have gone through was how to break bad news. And like, how do I tell the patient that he or she has a brain tumor, right? Which is most likely to be a glioblastoma even. How do I really ensure that, that the patient, is well informed, but is also well prepared enough for me to to break that bad piece of news. And obviously, I mean, there are like the spikes guidelines and everything that can really be helpful. But then we actually had that example of a GBM patient, and one of my friends asked our mentor, our lecturer, whether or not we are supposed to show a brain MRI image to the patient. And I mean, I'd be very curious on what you think. Perhaps Natalia, what do you think? Should we be showing patients their own brain MRI?
The own brain MRI with a brain tumor, yeah?
Exactly.
That is
imagine
pretty well shown, yeah, that even person with, well, personally, it depends upon what patient I can see in front of myself. When I talk firstly to the patient, I can see what this patient is, like what is this in her or his or her education, what is his or her point of impression, what is his or her mental state. When I talk to the patient, like I see this, and also I talk to the relatives, and also I talk to the children, and then taking into consideration all this background, I can make my decision, like, okay, to this patient who is like woman 45 years with 2 children, who is very usually cries or talking to me with a lot of emotions, like, oh my God, what should I do? Please help me. Right, of course, I will not show this to her. Otherwise, she will fall down with coma, and I will have to deal with her. But if I talk, for example, to the patient who is a doctor himself, so it's another condition, or if I talk to the patient who is mentally stable, it depends. So we as a doctor, during the first communication with the patient, we have to consider a lot of things. We don't have to think on the patient like on the book or on the like something on live. It's a live person with emotions. Right. So usually, me personally, in my medical practice, I really do consider these things. I do talk to the children of my patient. I'm a neurologist, I'm not a neurosurgeon, but I do talk to the patient with this also patient with epilepsy. It's also the special kind of people. So I really do take it into my consideration, and I talk to the relatives. And then having all this, I can decide whether I show this or not.
Thank you so much, Natalia. Yeah, I think that is, I guess that is the best way to do it, right? Because it'll always depend on the patient. What we did to really assess how neurosurgeons globally do this was to conduct a survey-based analysis. And actually, Jason and I were just about to wrap it up and submit it very soon. I just want to tell you what came out. Interestingly, around what we did was to give basically 3 options. So either you ask your patient straight away whether he or she wants to see it or not, or you show it without even asking, like you just show it, as a principle basically, or you don't show it, right? You just don't show it at all. These 3 possible scenarios. And then what we did was to stratify the decision of the neurosurgeons by, certain additional parameters, such as whether it's a meningioma or a GBM, or whether the patient is over 60 or under 60 years of age, and etc. And what came out was first, a lot of critique. People actually came up to us saying, why are you even doing this? I mean, this is so trivial. Everybody should be showing the MRI to the patient. I mean, how can you not show it? It's their right? So a lot of people told us that the study was actually stupid. Now, I can assure you it was actually, I mean, I myself, I didn't know whether the study was going to be stupid or not, but now I am assured that the study was not stupid after all, because only around 40% did ask their patients whether they want to see it or not. And then 2 very huge groups, equal in size, would either show it every time or would not show it at all. And I mean, but by that distribution, you can tell this is a very controversial thing, and it is not trivial at all. And I just one thing that I believe is, or that we are trying to bring across, is the importance of asking the patient. I think it doesn't matter whether which socioeconomic background we're talking about, which level of education we're talking about, which potential histopathology we're talking about. I think the easiest way to find out whether one should show or not is by simply asking the patient. And obviously, in some patients, that is probably the minority. Seeing one's own brain MRI will be an extremely emotional experience, and it'll perhaps even cause discomfort and anxiety, and it'll probably aggravate the discomfort that has already existed. But in the majority of patients, I think seeing one's own brain MRI makes it a bit more tangible. Like it's obviously, when you hear brain tumor and everything, it is something that really, that's like a ghost that is somewhere in your head. But seeing it might make it a little more, visible, tangible, something that you can actually, imagine and visualize. And this might actually, help the patient to cope with his or her own disease. And that is why that's basically our conclusion to this, that we want to encourage the neurosurgical community to just always ask what the patient wants. And obviously, showing a brain MRI is really the most basic of anything you can do. I mean, if you don't show a brain MRI, then you won't show anything, right? I mean, now with the increasing advancements in technology, I think virtual reality was touched upon today. I mean, these are all things that we try to incorporate for neurosurgery education training, but why not use that same technology to have the patients benefit from that as well, right? I mean, we can easily reproduce 3D models of on the basis of the angiograms of the patients, where we can actually reproduce an ACOM aneurysm and have the patient put on the head-mounted display and have that immersive experience, maybe see the exposure that the neurosurgeon is planning. So I think there is extreme potential for patient education in neurosurgery that is just like in its very very early stages right now.
Yeah, Ibrahim, I just wanted to ask, this survey was made only in Germany, yes, with the German patients, is with the German doctors. So I just wanted to add that really, well, education maybe doesn't matter, but there are many things that matter in different countries with different people, and also the medical law, Some
Right.
people may come to you and say, you obliged to show me my MRI, and this is something like, it's really complex problem. But yeah, you are right. Sometimes it's really important to ask. Maybe patient just don't want, and you just show it. Like, yeah, it's really not stupid survey. And remember that all great inventions, it was the most stupid things that humanity would ever think. But generally, then it became really great. So you don't have to worry about this.
Right. Exactly. That's really all that I wanted to share with you, honestly.
Okay, so who is going to be present next? Dilara, Jason, Diego, Daniella?
So I think I'll go next. Joshua, is that correct? Okay, I think she's nodding. So I have the I have the honor to speak a bit about neurosurgical education and neurosurgical research. Ibrahim already touched upon the part of neurosurgical education, and I'll just share my screen and the slides. So I'm very excited to be here as well. I want to thank the organizers. I want to thank Yusra, who invited several of us fellow medical students from different parts of the world to join her in speaking about neurosurgical education and especially about the perspective from the medical students before, during the COVID pandemic, and also some potential implications down the road and a potential outlook. So I'm very excited to speak about this specific part about research and about the involvement of medical students in research before and during the pandemic. And so basically I will speak about the pre-COVID era, about the COVID era, about how the COVID era also had some implications on global cooperations, about global synergies. I mean, today we are from 5 different countries, and we all met through the COVID pandemic. I think that's something we should also mention at this point. So I'll speak a bit about global cooperations and the outlook. And I want to start with kind of how where we were before the pandemic. And this was a study by Price et al. From New York, where they looked at medical students' involvement in research, and they included major hospitals in the US, and they found several departments with 50+ first authored medical student publications, and also concluding that medical students are heavily involved in the neurosurgical departments and the research there. The time period here went until April 2020. And so after that, there was some change because of the COVID pandemic, which is still to be found out what changes have been taking place in that period. But they looked at the observed time period was until April, and between 30 and 50% of faculty members at each hospital were involved with medical students in research. So that's the starting conditions where which it was before the pandemic hit, and research was also key in involving medical students in neurosurgical education. So the large portions were surgical skills workshops, so at conferences, so educational opportunities, but also some research opportunities for medical students. And this then also guided medical students in their choice, in their career choice towards neurosurgery. And also research opportunities are a major factor in why medical students eventually choose to pursue neurosurgery. Next to interest in neurosciences, Ibrahim also mentioned the technological advances in neurosurgery, which are quite fascinating to see. So just to recap briefly, medical students were heavily involved in the pre-COVID era in research at their Department of Neurosurgery. And those medical students, particularly those eager to pursue neurosurgery early on, need to be integrated in research even in the COVID era. And their involvement with the Department of Neurosurgery at the home institution through research remains key in why they eventually make that career choice. We all know that 2020 then suddenly changed this. The AANS issued several guidelines, this one here from August, where they emphasize again, as they have done in the past, and for example in March, when the first lockdown was imposed. Here in August, they state again that current medical students are students and not employees. And the AANS has repeatedly emphasized this to, on the one hand, and to ensure that a medical education is still possible through virtual and through remote learning formats. But at the same time, they also emphasize this again and again to make sure that institutions and hospitals adhere to health precautions to really keep patients, healthcare personnel, and students safe, and to not put students, but also the patients who are often at risk of getting infected with COVID and having a more serious course of disease. And this then raises questions of how neurosurgical education can still go on in such times, and also the impact on how involved medical students can be with their neurosurgical department. The impact of COVID is just starting to be measured. This group here found that the impact of COVID-related measures on the status of research projects is also concerning. That several, especially in the basic sciences, research projects had to be cancelled, had to be slowed down. And this then raises the question: will we see a delay in starting residency? I think some of us here in the panel, some of us medical students, are also thinking about extending our studies, and this was also measured here, that the likelihood of taking a year off, or in where we have a semester calendar, for example in Germany, a semester off at least, is now significantly higher after COVID than before. And so now in the COVID era, we have seen so many new virtual formats being implemented, being kicked off to ensure that there is access to neurosurgical education and also scientific opportunities. They here reported on a West Coast curriculum where they gave a list of different sessions, of different session structures. And one of these panel discussions here was about research in neuroscience and neurosurgery, to not only raise awareness, but to also inform medical students about the opportunities, about research opportunities in neurosurgery. Garcia et al. Also published several recommendations what should be done to involve medical students in neurosurgical research and also neurosurgical education, to allow for virtual educational opportunities, to allow for mentorship programs, to engage students also to be involved in COVID research, and to make sure that the transition process between the internship year and residency is implemented as smoothly as possible. Many programs across the US and abroad have implemented their several virtual formats where medical students can look into the residency programs at different institutions, even offering some advantages, because medical students don't have to travel between different institutions, but can remotely, for sometimes just a few days' time, visit virtually or remotely visit an institution to get an impression of the faculty and of the atmosphere. So just to recap again, in the COVID era, medical students experienced a sudden decrease in exposure to the clinical environment, to a sudden decrease in patient contact. And on the other hand, online tools were widely adopted to allow for this crucial interaction between medical students and residents, and also between medical students and faculty members in pursuing research opportunities. I now want to move to the part about global cooperation. We've heard this a lot. COVID is fundamentally changing how we practice, or how we also approach medical education. But COVID is a game changer, yes, but it is also an enormous opportunity for fundamental change. And this is where I want to go back to what I said in the beginning with how Yusra, Ibrahim, Ala, Makina, and Dilara ended up in this call, like all together. We didn't know one another before the pandemic, but due to because we were all interested in pursuing, we are very interested in pursuing neurosurgery. We found together. We are working on different projects, and one of them is also to democratize scientific research, to work together on different research projects, to enable access for our fellow students in research. And this then also ties into this aspect that medical students have different access to scientific opportunities in different countries. And we hope to alleviate some of these differences. And borders do not play a role in Zoom conferences like this one. Rather, it has become the norm to talk with other students on Zoom and on other platforms. And this is really the norm now for also all of you distinguished audience to work and speak with your colleagues on an almost daily basis across borders. And this is the outlook. Then we also plan to through these research opportunities and through creating more research opportunities for fellow students. We hope to implement two important elements in this. We want to work with practicing neurosurgeons on these projects where we approach practicing neurosurgeons. And at the same time, we also want to allow for mentoring opportunities. And I think some of the studies I've referred to throughout my brief presentation, they also mentioned that mentoring opportunities are largely implemented through these research projects at several institutions. With this said, I want to thank the audience. I want to thank the organizers. I want to thank my fellow students in this call that we could put this together in a very short amount of time. Thank you so much.
Thank you, Jason.
And who is left from your team to talk? Dilara?
Yeah, it's my turn now. I'm Dilara Akkad. I'm the Vice President of Dandi Turkey. I'll be here to talk about technology and neurosurgery. I would start by saying that the two fields of technology and neurosurgery are like white on rice. They're arguably inseparable, and if I dare to say, complete one another in every matter. One thing we can all agree upon is that the brain, unlike any other organ, is not easily accessible, and that creates certain barriers and obstacles along the path of trying to diagnose pathologies and treat them that are related to it. Here's where technology plays a very major and impactful role, as it has paved the way in areas from diagnostic techniques to operative guidance systems, surgical equipment, and monitoring. It wouldn't be wise of us to deny that to many patients, the rapid growth of high-tech adjuncts and their integration and combination with neurosurgery can be overwhelming. Thank you, Jason, for sharing the slides. It is also important, though, to highlight that the desired end result is the same, and that is for patients to receive the best possible care with the aid of the best available tools. I would like to shed light on the main disciplines of technology now, technology and education, and last but not least, the future of technology, all in the field of neurosurgery. Next slide, please. Next slide. Yes. First, we'll be starting with 3D imaging. 3D imaging and microinvasive surgery, neurosurgery, are both two skyrocketing modalities used in the junction of technology and neurosurgery. And they work hand in hand, go together, and are correlated together. When they're two important modalities that have been showing an exponential growth when referencing to the effect of technology on the field of neurosurgery. The benefits of 3D imaging include creating 3D interactive images that can improve visualization of structures and direct measurements that would enable better medical decisions when viewing structures in the body. Additionally, 3D imaging would enable easier tumor and anatomical location that would eradicate the need for the viewer to interpret the depth of the image. Other than that, radiologists and surgeons may spot pathologies and anatomical discrepancies in 3D models that may potentially have been overlooked, thus also helping in advancing diagnosis and treatment planning. 3D imaging, however, is not only beneficial for the surgeons and the doctors, it also helps in the field of patient education. Like Ibrahim touched upon, explaining the anatomical structure of the brain, especially the cranial nerves, could be a little challenging if we only use 2D diagrams. Using 3D models can help describe intricate and complex anatomical structures, allowing the patients the chance to fully grasp the concepts explained. We can also use 3D models to help patients have a general map of the procedure before their surgeries. Again, like Ibrahim briefly said, it would help them be completely aware and understand totally what is happening or what is going to happen through the process. Next slide, please. Coming to microinvasive neurosurgeries, a dogma in any field of surgery, especially neurosurgery, is to effectively treat pathology with minimal disturbance to the normal anatomy. In microinvasive surgery, that is accomplished via designing surgically surgical smaller incisions, which would result in less soft tissue disruption and involve limited surgical invasive passageways. Limited invasive surgical passageways, however, could be ironically more challenging because due to the limited surgical ports, more recurrence and reoperation rates can result. There would be an increase in both recurrence and reoperation rates, especially in the realm of lumbar disc surgery. In spite of these challenges, though, the evolution of minimal access spine technique, MAST, has exceeded that of traditional spine procedures over the past 2 decades. And this began with Professor Yashagil's adaptation of the operating microscope to lumbar dissecting in 1967. Next slide, please. Robotics is another dimension in which technology has excelled markedly and is dramatically changing the way procedures are done and performed. Robotic approaches have been utilized in about 9,000 neurosurgical procedures. They integrate and interpret data, calculate targets, also manage repetitive tasks. In the field of neurosurgery, image-guided robots have an immense role in helping practitioners improve precision, dexterity, and accuracy, as well as reduce fatigue during long procedures, which is really important. Next slide, please. Last but not least, I would like to shed light on intraoperative MRI, which has been evolving and has been integrated into stereotactic procedures such as DBS, deep brain stimulation, gene therapy, and brain infusion. In our next segment now, we'll be talking about technology in neurosurgical education and training. Technology is without a doubt very user-friendly and has been adapted into the daily lives of the majority of this world. It's also unquestionably influencing neurosurgeons and how they're educated and trained in many ways. 20 years ago, a physician would have been studying using books and references, information regarding his or her specialty, as well as hands-on training, of course. Now a resident can have access and store an entire library of neurosurgical knowledge and reference materials on an iPhone or a pocket mobile device. Neurosurgical trainees can also access video simulations and do board questions, having them a tap away from them. Next thing I would like to discuss is the significant interest in the field of neurosurgery to explore and utilize virtual reality and simulation for purposes of training, skill maintenance, refinement, demonstration, and assessment. That does, though, go a bit into the future of neurosurgery since it's still under progress. It's still a work in progress. The aforementioned methods of virtual reality and simulation, though, would also allow surgeons, apprentice surgeons, to practice procedures, permit performance evaluation, and provide active surgeons with the means to rehearse difficult cases in a totally risk-free environment. There are hurdles related to simulation, which are like cost and logistics, among other obstacles that simulators still face. Results obtained from studies regarding the matter, though, may push for the acceptance of simulators in neurosurgical training for the goal of patient safety. The future is promising for simulators in neurosurgery as they become more engaging and representative of real surgery. However, their widespread use across neurosurgical training has not yet taken hold in the field of neurosurgery. It has started in general surgery. It's still under progress, though, in the field of neurosurgery. Last thing I'd like to discuss in this segment would be surgical performance. No, 2 slides before. Surgical performance and certification. To a large extent, surgical training programs are moving toward a more structured curriculum in which physical models and simulators will play a more important role in developing surgical skill and evaluating and certifying trainings. To a large extent, resident training has been based on an apprenticeship model in which individual surgeons graduate from simple to suddenly more complex tasks. Although this has thus far been a reasonable approach, it goes without saying that practicing the process or the surgery itself with simulatory mechanisms or programs before operating on a patient would provide unsurpassed results. It is, though, still under investigation and needs approvals. Finally, I would be talking about future neurosurgical technology. We already talked and covered simulation. We did say it's still a work under progress. Another thing, though, that is a huge part of future neurosurgical technology is functional neurosurgery. Patients can anticipate a significant increase in innovation and impact on a wide spectrum of diseases. Functional neurosurgery lies at an intersection of technological and scientific clusters of innovation. There are several distinct areas in which this field will be transformed, including cortical and sensory motor interfacing, under which it is anticipated that it would be possible to restore function in paralyzed, blind, and aphasic people. Other than that, deep brain modulation and spinal cord modulation with autonomic modulation also are anticipated to have great advances in the future of neurosurgery and technology. Last but not least, which is really important, the safer, cost-effective restorative future in neurosurgery. Think of it this way. We can have the best of both worlds by clinically adopting truly individualized personalization of therapy, and reductions in costs would be made possible by larger businesses. Add to that mix competition and technological innovations, and the end result would be an overall cost reduction and improved access to a various large quantity of therapies within the healthcare system. I would like to end my part in this presentation by saying it's really, really inspiring how the advances of technology are helping us in the field of neurosurgery. It's also inspiring that our specialty is willing to embrace this advances in technology. We have to take care, though, of the connections that we can develop with the patients. It's our jobs as doctors to acknowledge the patient's feelings of anxiety, despair, uncertainty, and disability, as Ibrahim said. These connections are very vital to make. They make us the best neurosurgeons that we can be, doctors in general. And with all the possibilities technology provides, it can dehumanize the patient care. We need to provide excellent innovations and the latest technologies, but we need to couple it with human touch, the empathy, comfort, and hope for our patients. Thank you very much.
Yes, thank you, Dilara. We have one more person, Makina Haq. Yeah, she will talk next.
Yes, yeah.
Okay, Makina, take your word, please.
Hey, thank you. First of all, so far the talks have been fantastic. I hope everyone's enjoying themselves as much as I am. So hi, I'm Makina Hack, and I'm a member of the Street Committee of the Walter E. Dandy Neurosurgical Chapter in the UK. I'm actually a fourth-year medical student at King's, and currently I'm doing biomedical engineering at Imperial College London. Let's go to the next slide. So I want to talk about generally the general benefits the organizations and groups, and moreover looking at how societies and organizations for students in neurosurgery are beneficial overall. So we'll be going through some specific moments. So let's go back one slide for the general benefits of organizations and groups. Perfect. So there are a lot of general benefits we have when we normally focus medical students, but generally the workforce population into organization and groups. And there are quite a few reasons for that. One, with numbers, the ideas and projects that people want to put out naturally have more impact if you move from an individual to a group setting. And that's because people collectively together have a lot more power than the individual voice. And that is an incredible thing to be able to harness because of the wider reach and that implicit impact you have when you want to put ideas forward. Organizations and groups are also very useful because you can transfer different skill sets, you can learn things from different members, and you can learn how to collectively harness people's strengths and strengthen their innate weaknesses as well. So it usually involves taking an individual, putting them in this sort of situation, and when they leave these organizations or they move on to different organizations, they inherently become much more confident, much more well-rounded individuals. And that is inherently important in the medical profession because those are the types of skills you need once you're a practicing doctor within neurosurgery and outside neurosurgery. So those are when we move to general benefits in organizations. And that's why it's so important and why I always advocate for medical students to get involved in these groups. Of course, they can be quite intimidating, especially when it moves into from a local level to a national level to an international level. But because of the confidence you can build, the communication skills, the connections as well, there is a large scope of networking as well, which I don't think enough people talk about. These organizations and groups can help springboard you and put you in a position where in future, if you have ideas or projects that you wish to do, that you feel outside of your scope, if you learn how to harness a network, if you know how to reach out to people and work collectively with them, you put yourself into a much better position in the future to be able to actualize those ideas. And that's something that I think the Walter E. Dandy Society is really focused on doing. Now, moving on to the next slide, the specific benefit neurosurgery organizations give to students is something that we can't underestimate. Neurosurgery as a profession is something that is widely misrepresented, I think, in some ways. There's a lot of mystery in the profession, and there's this idea that you have to be a certain type of person to be able to pursue neurosurgery and to be successful in it. And I'm going to be honest, that was a perception I had very early in medical school before I actually started meeting neurosurgeons. And that's when I started to realize, oh no, you don't have to be from a certain class, a certain background, you don't have to look a certain way, because the neurosurgeons that I was seeing in front of me, who were all widely successful in very different fields in neurosurgery, all looked different, all had their own stories. In fact, some of them had stories that were so similar to mine. And that was really important for me because that showed me that it is possible for people who have my kind of background or who have my types of ideas, they can thrive in this type of specialty. And that is one of the key benefits of having neurosurgery organizations. Now, when you put that specifically for students, you now have the opportunity to meet other students in your situation who have those passions as well. And that links back to the general benefits of the organizations. When you have shared ideas, shared projects, shared values as well, and you put those together in a group format, you instinctively are much more likely to be successful in the goals that you wish to pursue. And you shouldn't underestimate the impact your peers can have on you in terms of your motivation, your drive, and your ability to improve. There is always something you can learn from other people that you don't currently have within yourself. And at the same time, there is always something that you can pass on to other people that they may not have or they may wish to improve. And this is where it directly ties into the idea of medical education. I think when we think of medical education, we instinctively think of the teacher and the student dynamic. There's someone up on the board who has has this type of knowledge to give, and there's a student who takes it in. Medical education in this specific field, and I've seen generally, is not so unidirectional. It is multidirectional, it's multicentral as well. you can learn things from the teacher, but teachers can learn things from you. And also the dynamics that we have an idea of what medical education is are being broken down, because as a profession, we are starting to lose the idea of rankings, and we're starting to employ more of a flat leadership style. I've noticed overall, even within the Walty Dandy Society, the first thing that I was told when I joined is we employ flat leadership. And that is so we can listen to our members' views without having this idea of boundaries in place, and to make people more comfortable, and within that, more confident. This is also especially important because having neurosurgery-specific organizations for students imbibes this sense of community, which I think people can lose very easily within medical school, when you have this idea of this constant pressure to do well, this constant idea of competition, because it is competitive against neurosurgery, but that doesn't necessarily mean we have to take those values into everything we do. I think the biggest benefits I've seen personally within the idea of student organizations is that it breaks down this idea of toxic competitiveness, and it really gives insight to individuals who join that there are more than enough spaces for everyone to do to the very best of their ability, and we can share out this success. It doesn't necessarily need to be kept to one or two individuals. It can certainly be shared out. There is more than enough to everyone, and we can do that when we put ourselves in the position to create opportunities. Now that links to my next point, which is how can leadership positions inspire neurosurgical education? Neurosurgery as a profession is incredibly stressful. There's a lot of pressure put on, as there are with every profession. But I think neurosurgery is quite unique in the sense of the negative impacts that can have if you have bad management of patient conditions. Now, if you put yourself in that situation and you think, okay, now I'm a medical student, but let's say 5-10 years in the future, if you're a neurosurgical attending, the first thing you need to have is the idea of how to have good leadership, how to have good management skills, how do we handle different types of personalities, how do we bring out the best in them in a manner that is central and allows for this community spirit to be there. So that is something you can directly develop in a student organization and general organizations as you progress as well, and bring across directly into neurosurgical education. I think putting students in leadership positions helps imbibe that sense of responsibility, that sense of clarity, and that sense of conscientiousness that you would need as a neurosurgeon. But you learn the skills earlier, and with that, you are safer to make mistakes that, perhaps as a surgeon or as someone more senior, could have much more serious impacts. So it creates this safe space for you to be able to explore what your leadership styles are, for you to learn those big lessons. So by the time that you're in the position when you want to apply, you've put yourself in a very advanced position compared to maybe some of your peers who haven't gone down this route, simply because you've had more chances, more opportunities to develop your maturity in this specific area. And I think another great, a really good of generally having this benefits of organization and groups, which is on the next slide, is mentorships from neurosurgeons. We have this I think a lot of people don't have the correct perception of neurosurgery in a lot of ways. And as you go throughout medical school, as you go throughout your career, your perception of different specialties changes with you as your own outlook and your own experiences shape how you view medicine as a whole. So if you want to go into neurosurgery, the best person to have to look over to help direct you are neurosurgeons. And that is because they can share their knowledge, they can see what route you are going down. And I think when we're in that position ourselves, it's so easy to adopt a tunnel vision into what we need to be doing, what is the right thing for us. And I think it's safe to say that we're not going to be the best mentors for ourselves right now, because there is a lot of aspects actually about the career that we're not going to have that specific or deep understanding of. And that is why we need mentorship. And mentorship can take many forms. It's not necessarily always career-driven. You can have an emotional style of mentorship. You can have that support that you need, that confidence, that idea that if you do something wrong, there's always someone there who's going to help pick you up and is going to help you do well in future. And I think that is also something that we need to look at and consider as well, which I think is such an important thing to nurture as well. This links nicely to the next part, which is student perception and insight of neurosurgery. I've just said beforehand, I think there are limitations that we naturally have. And I think the COVID pandemic has made those limitations stronger in effect, because we're unable to access clinical experience as easily as before, which is a really big shame. And I think worldwide, there has been an impact on neurosurgical medical education as well as medical education as a whole, because of the limitations in place. So when we're in a stage where it is harder to have face-to-face learning, where it's hard to speak to someone face-to-face, that means naturally our emphasis needs to be on online medical education, online electives, online clinical electives. But then, because of the current state of the situation, I think something that needs to come is that if students want that change, if they want that implementation of having those resources that would be more readily available in an online format, then I think students need to be the driving force. They need to be able to effectively raise their voices and bring about this change, essentially. But you can't do that unless you have those leadership skills, those communication skills that I mentioned earlier in place. And that is why widening skill sets, which is on the next slide, is, I think, overall one of the strongest things you can develop from organizations and groups. And that's, like I said earlier, because if you're working with people who are from different areas of the world, who have different perceptions, who've had different experiences that have shaped them, there is so much you can learn from them in the same way that they can learn from you. And that is what helps makes you more of that well-rounded individual and makes you more informed. But I think also putting yourself in the situations in those organizations where you're constantly doing something that's new to you, you're constantly moving out of your comfort zone, you're constantly evolving in that sense, that puts you in a better precedent in future to be able to develop more skills in future in an easier way. You're more dynamic in your thinking and your outlook as well, which I think is also useful in medicine, given how even a patient's status can change in the next 5 minutes. And finally, I think the biggest draw, specifically for the Walter E. Dandy Neurosurgical Society, is the international context we're working in. I think something that I've noticed is with the medical profession, there is so much that relies on teamwork and communication. And I think as we move towards more of a globalized world, which isn't due in part with the fact that we have so much more online networks available and social media and networking online is much more normalized, it is certainly something that we need to make the most of in the situation that we have now. Pandemics like COVID-19 are always going to be around in some way, shape, or form. In fact, some people have been kind of quick to say that this could be our new normal, whatever that means. And I think if we are in that position, it makes it even more important that we solidify these connections, that idea of community nationally, but also internationally, so we can continue to learn from each other, continue to put ourselves in that dynamic set. And that is how I think student organizations, groups, and any sort of grouping and be able to work together with people, whether it's as a student or as a doctor, will always be very useful for medical education within neurosurgery and beyond.
Yeah, thank you, Makina.
We have one more speaker.
Yeah, but we are actually running out of time. We have few questions to discuss. Who is the last speaker? Could you please show up?
Here, she's Ala, right?
Ala Mustafayan. Hello, Ala. We've seen each other previously. Okay, so if you can make your talk as short as possible, but of course, we will give you the time to talk because you were prepared. Just please try to be more, because we have another team to speak, and it's really just to not be all the tired, because we want to get the information, not to feel tired, So yeah, please continue, but try to do it like more complex. Ala, if you are talking, we don't listen you. We don't hear you.
Muted.
Okay, sorry.
Yeah.
Allow me to introduce myself. I am Ala Mustafa Andil, the president of Walter E. Dandy Society in Egypt. I'm a medical student at Qasr Al Aini University, Cairo University. I would like to summarize the voices of my colleagues and simply say that our vision as students is that we want more. We want more access when it comes to knowledge. The technology and the internet now is serving as the route to access, but we need to have knowledge that's widely available for students, young future physicians and the neurosurgical residents. This knowledge is obtained from the resources that we were built throughout the years and delivered by current neurosurgeons. We believe in the strong role that mentors play in our future education. Mentors like the great ones we have today with us play in our future education. Those ones are the ones we aspire to be and get knowledge from. We believe that training opportunities delivered to young physicians under the supervision of well-trained mentors will serve in securing a better future for students too. And the applications of neurosurgery knowledge is not available globally equally, and the research opportunities likewise. We believe it's of great importance that we create a safe space with equal training opportunities and to participate and conduct researches, and thus contribute in the cycle and the built-up knowledge of neurosurgery training and education. And from that belief, there is the surface organizations like Walter Identity Society that we as students feel very honored and privileged in serving a great purpose of securing a better education for aspiring neurosurgery and students like ourselves. And it's in events and congresses like this that we feel heard and valued by those who have worked so hard to be the best for us. I'd like to thank you and thank you to everyone for giving us this opportunity and time. And with that, I conclude my speech. And thank you, Natalia, and thank you, everyone.
Oh, thank you, Ala. You were really fast. Oh, thank you. Well, you already have been
as
in
much
the
as
Congress,
I can.
and now you have really great connection. So we are happy to hear you, and you did a nice conclusion. So could you please stop sharing the screen so we can see each other? Who is sharing the screen? I think if you have done
Jason?
sharing.
Jason,
please stop sharing the screen.
Yeah, please. So we can see each other. Yeah. Now we have few questions related to the, like, as all of you know, that Walter Dandy Neurosurgical Society and also the UNESCO, like United Nations Scientific, Cultural, and Educational Organization, have organized this Congress. So we have to discuss some questions regarding the UNESCO and is this Congress served to educate neurosurgery students and why? Like, if you have some point, just to tell a few words.
I'm sorry, Natalia.
Yes.
Got a message. We have to stop this session.
Yeah, we have like 5 minutes to discuss a few questions, and then we will stop the session. Okay?
Yeah, because we have the group from Brazil and the group from Mexico waiting for us.
Okay, 5 minutes and we stop. We have just to honor the UNESCO because due to this organization we have this Congress. So it would be not really nice to just miss it up. So okay.
I would like to answer if that's okay.
Yeah, please.
Okay. Well, I'm sure all my colleagues here, we share the same idea that through the pandemic, life has changed, and to access education or knowledge or any form of something new or something informative has been quite difficult or impossible in some scenarios. So to have this honor, to have those great people who I'm sure had their busy schedules and surgeries and everything else choose to organize this and sit and educate. And I mean, they would I hope they would meet me one day, but they have not met me so far. And they have done this really big thing for me and for all of us. So I think it's truly honorable and selfless. And I'm hoping more doctors, more neurosurgeons would, because, I think we do have great doctors everywhere, but we do not have humble doctors or doctors who like to teach. So to just see this great example of people, it actually paints a very beautiful picture of tomorrow. So I do think that. Thank you very much.
Yeah, thank you, Yorsa. So, well, I want just to conclude, okay, so we have talked about the educational point of the Congress. Also, there is a scientific point of the Congress if we would like to do the science, if we would like to do the research or survey. We have to have a lot of interactions, especially in different countries with different doctors. So, the possibility to join live and online and to get contacts during this Congress, I guess it is possible, and it is really something that get used for us, get really useful for us. And the last thing is the culture. Like, we are here from different cultures, different points of view, different visions, but still we are together and we are discussing on the one point. And that's it. So we all, I guess you all are supporting my point, that we are all grateful to the UNESCO organization for not caring for the country's heritage and also for caring for our education, science, and cultural use. So that's really it. Okay, Alejandro, actually, you can stop to be in live. Okay, so we are not live now.